Anyway, let's get into our conversation now, which is on Nairobi City County and doctors in Nairobi County who've been on strike for quite a while. We've seen the doctors actually pouring out on the streets and raising their issues and their concerns. We've seen some response from the Nairobi City County government, the CCM for Health, and others speaking about what's happening. Also seeing some CEOs of some of these public hospitals saying, we have had to hire doctors on locum to come and take the space of the doctors who are out there on the streets. Now, Dr. Maero Deogracious is the chair of the Kenya Medical Practitioners and Dentists Union Nairobi branch. He's our guest here today. Good morning, Dr. Ari.
Good morning. I'm happy to be here. Huku kuna waka?
Hatujui. Hii Nairobi yetu, hatujui.
Wetu pale tunatoka hakuwaka.
The problem is when doctors say hatuwak, ama haiwak, sisi ndio tunaumia. Sisi ndio nyasi. All right?
Yeah.
But Doc, as we get into the conversation, Jano is going to welcome you with today's quote.
Yes. Today's quote is by a Nigerian economist and philanthropist, Tony Elumelu. He has a lot of fans.
He does.
Our guests have been like, I know him.
I know him.
But he once said, you must prepare yourself for leadership and it will come to you. Do you agree?
Wow. Msema naitwa nani?
Tony Elumelu.
Tony Elumelu. Yeah, obviously I agree. I think it makes sense, by the way. And just to pick up from what you're saying, it's true. You have to prepare yourself first for leadership. And of course, once you are ready, then everything else will come to you. I think that is one of the challenges that we are facing as Nairobi County, that probably most of the leaders that are heading different dockets did not prepare for this. Yes, they were just put there probably because of some political convenience. I know you campaigned for me. You're my friend, I know your mother, such things. I like what Latif said. Welcome to Africa. Yes.
Yeah.
So this is Africa.
Karibu Kenya.
Karibu Kenya.
Aya basi. Let's get into our convo around the doctor strike, the Nairobi doctor strike, joined by clinical officers as well at some point. But let's start with, why are we on strike again?
Same old. Nothing different. I mean, this song cannot be rewritten. It's been there since we came up with the public service, when the employer has to be pushed to do what they expected to do since time immemorial. And for Nairobi County specifically, we've had issues for the last 10 years. This is the third governor right now. And we've been talking about the same issues. Of course, the one that you always hear about promotions. This is something that we have discussed. The last time we went on strike was in 2020 for the same issue, promotion. We went, sat with the County Public Service Board, had a return to work formula, deposited in court as an agreement. Since 2020, we gave this government time, more than 4 years, to work on what we had agreed on. And it's simple, common cadre promotions, and of course, the other cadre promotions. They did nothing. After 4 years, I think now this year in April, this year, April, we went on another strike.
Last year.
Last year, in 2026. Welcome to Kenya. Last year, April, went on strike for the same issue, promotion. That lasted around 39 days. We had a number of deliberations, went to court. Again, it was a court-mediated process. Sat down, had a return to work formula. Things were supposed to be initiated by July of last year. It's been more than 8 months. Still nothing. And these issues just keep on cropping up. So the most important issues right now are promotions. We're talking about medical cover. And in fact, when Sakaja's government came in our first meeting, because they had this thing called a task force, health something task force, and they invited us as stakeholders. The first thing we told them is, usiguze medical cover. Do anything else but medical cover, we will not negotiate. So comes last year, December, they touched medical cover. And that's the only reason why they went on strike, because we were willing to give them time to sort out the issues of promotion, sort out the issue of gratuity, and so many other things. We gave them time. More than 8 months, we kept on just discussing, having many meetings, but they touched the medical cover. So we said, no, this is enough, because we can't have doctors offering services and they cannot access the same services. For the last 2 months have been crazy, and I'll tell you about that. The other issue has been gratuity. These are for the doctors who are working under NMS. They were on contract. So the gist around it was they worked for NMS for around 2.5 years and Nairobi County for around 2.5 years. Of course, we know the public service laws. You work on contract, it's supposed to give you gratuity at the end of your contract. That did not happen. We went on strike last year, April, for the same thing. We had an agreement. They sort it out by August. We've given them time. They've not done anything on that. And then the other things that just keep on coming up are issues of delayed payments. So, in fact, our December salaries just came the other day. I think, was it 18th, 17th? December salaries. So they've always been delays. There's a time it delayed for more than 2 months. Yes. So that, among some other issues that probably might say small issues of individual doctors here and there, but those are the 4 major things why you're on strike.
When did you start issuing, just take me back, for this particular strike, when did you start issuing a strike notice?
For this particular strike, that was in 2020.
Okay.
Yes.
2020?
2020.
So in between, there's been negotiations, and there's been, what, any commitments?
Return to work and all.
So in between 2020 and 2024, 2025, there was nothing. It was us reminding them to do. So we kept on just writing letters and reminding them, requesting them to call us for meetings, reminding them that we had a commitment on these issues. But there was no, we didn't get any positive feedback. Once in a while, they will call us for a meeting, sit, they'll give us the same excuse of staff establishments, the issue of budget and all those things. We need to create these positions and such. So that was like 5 years. Now, actively between 2025 April and now, because 2025 is when we issued another strike. This one, we are just upholding because we had suspended the strike. So it's not a new strike. So in between, again, it was more of an effort from our side and a little bit of effort from their side. We make steps, but as usual, 1 step ahead, 2 steps back. So we don't make any progress.
I'd like to look at some of these matters. So you're saying the issues, promotion, gratuity, medical cover, have been the bones of contention throughout.
Yes.
But waliguza mulima,
Waliguza
medical.
mulima, yes.
What is this? What is the agreement in medical, and what did they do?
So medical cover, when they came in, that was in 2022. I think we were under Jubilee, and we told them Jubilee is working.
Government or insurance?
Insurance.
Jubilee Insurance.
Jubilee Insurance as a medical cover. And we told them, this thing is working. It's not the best. It's not perfect. It's not what we will want to have, but at least it's working. The beauty around Jubilee was if I fall sick right now, I'll go to any clinic around here in town and I'll get treated. I'm telling you, if I fall down today, right here at Nation Center, if you rush me to any of these clinics, Avenue, somewhere here, they'll tell you they don't take SHA. And that is the biggest issue with SHA. Now, I know SHA is kind of a political topic because some people say it works, others say it doesn't work. I personally know the intention behind SHA is good. I would gladly sleep in Nairobi, knowing that when my mother wakes up back in Ushago, she'll go to any hospital and she'll get treated using SHA because of universal health coverage, and she won't need to pay anything. So the idea was good. But the problem was how the whole thing was just carried out. It was carried out in a rush. They didn't think about so many other things. Now you go, if you go to any other hospital, most of these other private hospitals are not taking SHA, including if you go to Avenue, if you go to even Aga Khan. I think Aga Khan just came in the other day after they had a meeting and they were convinced. But most of the hospitals, I can tell you more than 50% of these hospitals are not taking SHA.
Private facilities will not
Most of
meet
the private facilities, they are not.
And so what did the county government do?
So that's the thing, and I was heading there. So with all these challenges, and we, as doctors, we have our members under SHA, at the national level. And they've been telling us these challenges. And the issue has always been accessibility as number one. Number two, of course, there are so many other limits in terms of dental cover, in terms of optical cover. You expect that when you go to see an optician, the SHA will only pay you for like 4,000 shillings for a frame that costs like 20,000 shillings. And you can imagine this is not just for doctors or maybe let's say middle class. This is for everyone.
Everybody.
Cuts across. So you tell a frame costs 20,000 shillings, but SHA can only pay for you 4,000 shillings. So a lot of issues with that SHA, and we raised it.
So did the government stop paying for your medical cover with the private insurer?
Yes.
And move all of you into only SHA?
They moved us to SHA.
Okay.
Yes.
All right.
Okay.
So that's and as they were doing this, there was no conversation with you?
There were no conversations. For the last 3 years, we've always had, as stakeholders, we've always had a say in our medical cover. In fact, the only reason why Jubilee was working for us was because before that, I think we were under AAR or something, or First Assurance. It wasn't working. So we went on strike, and we told them, the next time you want us to procure for us a cover, then you have to involve us. They did good. They involved us. We went all through this because we are medics. We understand these things better than most of those guys in HR. And we guided them through a process that got us something that for the last 2 years, there was no issue about a medical cover. But this time round, there were no conversations. There was no involvement of any unions. I'm told they involved some union called the Nairobi County Workers Union, which is okay. They have, I think, most of the workers in Nairobi County are under them anyway. But they forgot the most important union, and that is medical union, Kainan, KUKO, KMPDU, because we understand health.
Okay.
So they've taken us to SHA that is not completely...
It's not working at all for you.
It's not working.
Before Mariam comes in, you are employed by the County Public Service Board.
Yes.
Right? You work in the public hospital.
Yes.
Right? But you're saying that if you had a medical emergency today, you would prefer to first be taken to a private facility in Nairobi.
Yes.
And yet you work in a public hospital.
Yes. I move
I think the irony here,
yes,
that a doctor who works in a public hospital in Nairobi would prefer to go seek medical services in a private hospital in Nairobi.
Yeah.
Why?
Welcome to Africa. Karibu Kenya. Same challenges. As a country, we have not prioritized health. If you look at the Geneva Convention, I think health as a budget is supposed to be given at least 30%. 30% of the budget is supposed to go to health. We are not even at, the last time I checked, I think we were at 12, around 17. We're not beyond, I think we're less than 15%. If you look at the county governments, it's the same challenges. The national government has refused to support county governments in terms of health. Because what is the budget again? Less than 15%. So there's no investment in health. And we are there. We see. I can't go to a hospital when I know when I need oxygen, I'll wait there for 2 hours waiting for that oxygen to be ordered to come. Because we struggle day in, day out to treat these patients. We are struggling with medications, struggling, even non-farms. I can tell you, there's a time should have been Bagadi, because we were called. There was a surgery going on. It's an emergency surgery, yeah? And then there's no oxygen. So you can imagine at that point, no oxygen. So those guys struggle in that theater to just keep life alive as they continue the surgery, because the surgery has to go on. And then after that, we have more. They had more than six cases. But again, there's no water. And then we're being told there are no scrubs. Scrubs, those things, there are no scrubs. So you have to wait again for these things to be prepared for you to continue with the other surgical cases. These things happen every day in the public hospitals. So when we say, we see we are uncomfortable, it's not just the doctors. Even the governors, the Sakajas of this country, the Kinasufunas of this country, they will not come to Mbagathi for treatment. There's only one doctor who was a CS in Nairobi County who always went to Mbagathi Hospital for treatment. That doctor was called who? Dr. Aisi, the CS then. because for him, he had prioritized the public health and he was doing
so
everything.
the quality of healthcare in public hospitals is essentially not good enough.
It's not good enough.
Okay.
The investment is not there.
I mean, you can know it, but then hearing it from
Hearing the confirmation.
it's another thing. Let me go to promotions before I get into even the issue of medical covers, because the fix there is what we'll look for.
Yeah.
Promotions. Are there guidelines on how doctors essentially ascend and
Yes.
rise?
Yes.
How many doctors are stagnant, and for what reason?
So now we're talking about how many doctors? We're talking about more than 300 doctors who have stagnated, others for more than 10 years. Yeah, others 5 years. We have newly employed doctors who have stagnated for at least 3 years now. Yes, and the procedure is simple. For non-common cadre, you work at a position. Entry point should be M. So you work at M only 1 year. Then you are transitioned to a job group N. From N, you work for 3 years, and then you go to P. Those are common cadre positions. For non-common cadres now, there are a number of things in terms of you have to specialize.
Okay.
Need masters. Of course, there has to be a budget. There has to be the position available, and of course, an advert will be done, and all those things, which we appreciate.
Yeah.
We've never had an issue with that. So the only issue comes in when now our employers don't do their due diligence. Because you can't be telling us about a budget for 10 years. You can't be telling us about a position for 10 years. We've given you time to sort your issues out. In 2020, they told us, give us 4 months, we'll sort out the issue of staff establishment, basically meaning that you'll go look at the staff pyramid, increase the numbers here and there for it to make sense in terms of even the wage bill and all those things. We tell them, that's okay. They told us also going to the county assembly to request for the budget. We told them that is okay. It took them 4 years and they did nothing around all those things that they promised.
Let me ask what's usually happening in the middle of these strikes, because we've done the diagram of the strike, CBA not kept, strike. But what's happening between 2020 and 2024? When you notice, you were told in 4 months we'll have this and this in place, it's not there. What's happening in the background there? What agitation is going on? Are we pushing, or is it just let things, bubble, and then strike?
No. As a union, we've always been engaging. That is one thing we've always done and we'll always do. Because you see, for us, we deal with lives. And our priority is life. It's not even our money, by the way. It's not promotion. Promotion only comes in when our employers push us to the wall. That's why we give them time to do some of these things. So we are always actively engaging. And I can tell you, since April to now, last year, because that's when we suspended our strike, we've had more than 8 engagements with Nairobi City County. But do you know who requested for those engagements? It's the union. We are always requesting for these meetings, requesting for this meeting. Now, I'll give them one thing, because when we do this, remind them, they show up for the meeting. They call for these meetings. But the problem now is the action. That is where everything now goes down. It's the action.
Yeah.
Because they come, we converse, we talk. They tell us, we told you last month, but give us 1 more month. This one we just have to go and talk to the assembly guys, and we'll get it sorted, and then they disappear.
Yeah. Let me ask you, at this stage, what does effective negotiation look like? You've talked about the payments, you've talked about cover, but is effective negotiation bigger than that? Is it money? Is it respect? Is it structural change? Because I feel like it's ballooned into this big thing. So what would effective negotiation look like, and where would it start? And then where would you feel satisfied?
Effective negotiation starts at that point of the willingness to give and take. That is the first thing, number one. The willingness to give and take. But before you give and take, you also have to be willing to meet before you start giving and taking. The challenge in Nairobi City County now, ever since we gave them the strike notice, suspended our strike in December, they only called us for one meeting, that was in December, and that was because the judge had instructed them to meet us before that. So they called us on the date that was supposed to expire, 23rd. In that meeting, we only had, let me say, just junior officers attended. CS was supposed to be there, didn't attend. CEO of the board, chair of the board supposed to be there, didn't attend. The CEC Health was supposed to be there, didn't attend. And these are directions from the court, not from the union. Though we appreciate the other people turned up because, we are supposed to save lives, we are supposed to at least intervene. So we couldn't discuss much. They told us we postponed the meeting to January of this year, 6th. They called us for another meeting, I think on 8th. We went for that meeting very early in the morning. And you know what happened? They suddenly realized that the governor was issuing, bursaries, I think, or title deeds, something, at Uhuru Gardens. And they needed to go there. So you can imagine a whole health docket going to witness the governor giving title deeds. And hospitals have been closed. That was on 8th. So they called us and told us, please, let's meet at 2. We said we'll wait. So we waited in town. At 2 after that meeting, they called again and told us, unfortunately, after the meeting, they went, had a meeting, they had overeaten, they needed to have their insulin levels at least cool down. We give them time, they'll write us another letter for another meeting. I can tell you, since that day, they have not called us for a meeting. All this time, all the hospitals in Nairobi city counties are closed.
Yeah.
Are closed. Patient cannot access services.
What's the actual fix here?
Yeah.
Because this cycle of strike CBA, we've said it so many times on this show, strike CBA, county or national government doesn't hold up CBA, strike CBA, not sustainable. And if it is Mariam and Janet and Eric striking, you know what? People might be a bit sad, but no one is dying at the end of the day, right? There's no compromise to human life and to health. So long term, what is the fix here? As you look to get back to negotiations, what are you also coming to the table to find? You know what they'll tell you? They'll tell you promotions, we can do that in 3 months. Medical cover, they'll maybe say yes, no, but you will strike a deal.
I know.
You know? And then 2 years later, maybe a year later, when someone doesn't keep up the end of the bargain, we're right back here. So are you going back to the table with something more solid for our healthcare system as the KMPDU?
Yes.
What is that?
I can tell you, I'll give you 2 answers there. So there's at the county level and there's at the national level. At the national level, to me, the answer will always be a health service commission. To me, that would be the answer. I know we have, even among doctors, we have difference of opinion, which is allowed because we've seen what the TSC has done to the teachers. It has not been good. In fact, the teachers and organization are really going down. So there's that fear of, even if we have an HSC, Health Service Commission, will it be the final solution to this? Probably not, but it would be a start. Because one of the biggest challenges now in the country is unemployment. You can imagine in a country where one doctor is supposed to see what? Is it 1,000 patients? One doctor is seeing more than 100,000 patients. It's that bad. But again, in the same country, we have doctors who are not employed. Over 5,000. There's something wrong. So we need to fix that. The only way to fix that is at the policy level. Policy level is at the national level. National level, this is where now Health Service Commission comes in. We go back to, once a doctor finishes school, you're taken somewhere. There's always work for a doctor to do. Even in this county. They recently employed 300 medical officers, but it's still not enough. Still not enough. Now, at the county level, we just need people who are all life. I liken Sakaja's government to a 400 meter race where there's just a disconnect throughout. So we have Sakaja probably the Usain Bolt. Yeye atamaliza race. Ako huko mbele. He's psyched. He knows what he wants to do. He's been in that field for a very long time. He has experience of being in the government, being in the opposition and all those things. People are chanting, Ngumi ni Mbwekse and all those things, doing all those things they do. And then this other side probably is the CS as the first person who's supposed to run. A very well-meaning man, by the way. I talked to CS. We talked yesterday. So we will be having a meeting today after that talk. A very well-meaning man. He wants to sort issues out. He's also ready for the race. Now, imagine the CS starts the race, a race of his life. And then the second person he comes to hand over the baton anapatana na County Public Service Board. And that is where now everything just falls down. Because the first thing these people do is like they drop the baton first. Then they have to pick it up. And then they go on the opposite side and then realize it's supposed to be on the other way. But the worst thing about that whole thing will be, because the first three people are the strength of this race. So the second last person we know is the weakest, because that is the health docket now and the whole leadership in the health docket. Because everything that is happening in this county starts from that health docket and the leadership. CC kwenda chini. So them, they have no idea, hata waku warm up, no idea of how we'll finish this race. So for us to sort this issue out at the county level, we need to have a governor who's well-meaning, a county service, a county secretary who knows what they're supposed to do. But most importantly, they need support from the county service board and from the sector of health. That is the only way we'll sort this thing out. But if you continue this thing of borrowing support, I'll give you work, it will never work. And that is where we go wrong at the county level, is putting people in positions that they're not ready. Yeah, okay. They're never prepared for that work.
So it's a competence issue.
It is a competence. If you ask me, it is a competence issue.
Yeah. Sometimes sometimes counties or hospitals hire locum doctors and nurses. In a sense, do you feel like this undermines what you're trying to do? Or do you actually feel like it, I don't know.
It's an opportunity.
It's an opportunity, exactly.
Yes. For the unemployed to get employment as you take a break.
As you take a break.
In the name of a strike.
As you look for the button.
As a union, we support it because, as you rightly put, this is an opportunity for some other young doctors to practice, because we said the level of unemployment in this country is high. So that is one. The only challenge we have this thing is, number one, they're being underpaid. And the reason they're being underpaid is because they don't have the experience. So you're bringing in doctors to do locum who have not probably worked for a year, 2, 3. So you're still putting patients' lives at risk. And the only thing these locumers are doing is just to refer. Now, where do you refer? If you go today at Kenyatta National Hospital, it's full to the brim. Before we finish, I'll give you a story of a young girl, so that you can at least appreciate what is going on huku mashinani. So you refer to Kenyatta, it's full to the brim. Private hospitals are not taking the patients. Some of these other hospitals, organizational hospitals, organized by churches and all these things, they're not taking because it's also full to the brim, and there's also a cost to it. So, yes, we appreciate, because that is also probably offering minimal service, because we appreciate life. I can tell you right now, I'm on strike, but Janet, if you fall down, my first instinct will be to make sure that you're okay. Sitasema ati ni strike. If I go to Mama Lucy Hospital, because we usually move around each and every day by day, just to make sure, number one, doctors are not working. We want to confirm doctors are not working, but also to assess the situation on the ground. So if I go to Mama Lucy today, and a mother delivers on the way to the labor room, trust you me, I will intervene first.
But you're going to check that doctors are not working.
Sorry, that doesn't make sense. How do you walk into... Essentially, no one comes to a hospital to read a book. They're coming for medical care or to see someone who's getting medical care. So the minute you walk in there to see that no one is working, you will be met by people in need of medical care, whether it's serious things or a small injury.
That's true.
So then how do you decide, I'll intervene in this one, I won't intervene in this one?
No, it's not a matter of decision. This is a matter of, number one, for these other things, minor injury and all those things, we have the locumers who are supposed to give a first aid and refer to a specialist. But my situation, what I'm talking about, is this mother who has just delivered there at the gate. I will not walk past the mother, go to make sure that the doctors are not working, come, walk across the mother, and go to the next station. No.
But you're saying to not refer to specialists, but you're also saying the specialists essentially should also be on strike?
They are on strike. They are on strike.
So then
all doctors on strike.
How are these people being referred to?
They're supposed to be referred to Kenyatta, which is full to the brim.
Okay.
That is the only place now they can be taken to.
I know it's one of those things where when you hear it from this end, trying to get patients, and I wonder whether civil society and patients also weigh in on these strikes and whether that would build momentum for it.
Yeah.
Before we even get back to that, before I lose the trail of thought, I was also thinking, as I try to grapple with what he's just said, the reality of what a strike is, which is inafaa usiende kazi, even though.
And there's someone checking.
And somebody checking that you're not there.
Agenda kazi.
I wonder, I don't know that we've ever heard publicly the toll that strikes take on doctors and their families. Before I still want us to get back there because I'm still a bit, you know, I'm a bit not triggered. But yeah, it's hard not to because I could be a patient tomorrow.
Yes.
But talk about that part of the strike that we don't see or hear. What is happening with doctors and their families who are on strike?
It takes a toll. It's not the easiest thing. And to me, the toll is not more on the family. Because yes, I know you'll go on strike, you'll not be paid. That means you're not paying your bills. That means you're not paying school fees. That means affording a meal is an issue. The longer the strike takes, the more it takes a toll on you. But you see, for us doctors, the same thing I was telling you about, the toll is more towards what is happening to these Kenyans, the people we see each and every day, the people who cannot afford to go to any of these other private facilities. And we really struggle a lot. In fact, the first 1 week is usually the worst, because at least after the first 1 week, patients now know. The NTVs have done their work. Patients now know Mbagathi is not working. So you get sick, you rush to Kenyatta. The first 1 week is usually the worst because patients don't know. Patients come, there are no doctors. They're being told they're supposed to go to Kenyatta. Kenyatta, there's a fee which is higher than Mbagathi. You go to Kenyatta, it's already full to the brim because of some people already knew, so they've got already gone there. The worst are the deaths that happen during these strikes because nobody talks about these things. In our strike in April, sadly, I will say we lost 5 avoidable. Like these ones are avoidable because we do audits and we look at these cases. We see what are the cause of these deaths. Was this avoidable or not? I'll tell you 5, but the county government will not talk about that. The national government will never talk about this death. So the toll is more on the lives we lose, more than even to us individual as a doctor, which is still hard.
Yeah.
You hit like 100-day strike and it's bad.
Right.
Hapo sasa ni madeni
Yeah.
and talking to your family, talking to your friends and all those things.
Yeah.
But you see that one life, what do you do when you go back to work?
What does the Hippocratic Oath require of doctors?
To be faithful. Number 1, to the doctors. I only say number 1. I just said it. I'm not ranking it. So to the doctors, to the patients, to the profession, to uphold life. Yeah, simply put.
Okay. Where does striking fall in upholding life?
Striking falls in upholding life because you see, the worst thing you can ever do to a workforce is having a demotivated workforce. Because someone will argue that you're going on strike to get money for you as an individual. But remember, when I'm more motivated, I give you the best of everything. When I'm more motivated, I come to work happy, knowing that if you ask any doctor, by the way, they will tell you the only thing we need when you go with our life is you want to feel safe at workplace, you want to feel respected at workplace, and you have to have that professional fulfillment that whatever you're doing is good. That when I go to, I'm a gynecologist, by the way. That's why you see most of the examples I'm giving is just wamama, gynecologist. So when I deliver that mother, or a mother comes, the mother was bleeding, delivered from in some certain facilities, and we save that life. That is the professional fulfillment you want. As you're doing this, you want to feel respected and you want to feel safe. Yeah. So
I'm
even as an employer, yeah.
I understand what you're pushing for, by the way. There's never been a lack of understanding. Whether it's promotions, career progression, whether it's medical cover for doctors, these are things we should not be discussing.
That's
Even
true.
salaries of doctors, I don't think they're things we should be discussing. You know, what you ask for, you should be paid.
Yes.
But it's hard not to think about the patients. It's hard not to think about the lives. And I know that the only language the government understands right now is strike.
Yeah.
But there has to be some other way. There has to be another language. There has to be something where the collateral isn't human life. There has to be another way. That's why I keep asking, what's the long-term plan so we're not stuck in this cycle? And I don't know from the KMPDU if there is a legitimate push to move beyond this cycle. For government,
They don't care.
they could care less. But then from your end, what's, and it's not even a question at this point. It's due to Ndewapi. Yeah.
If you ask me, minimal service. This thing we've been told by a number of courts, minimal service. Each and every time we go on strike, that is the only time the issue of minimal service comes. We've tried engaging the government from the national level to the county level. We are telling them, the other time we were having a discussion with the Kenyatta University Teaching Research Hospital, Kutra. We are having a negotiation with the CBA. And we told them, because they wanted us to discuss minimal service on the CBA. We told them we cannot do this because minimal service is not specific to Kenyatta University Hospital.
Right.
This is something that's supposed to cut across. Please talk to the boss, talk to the PS, talk to the CS. Let them initiate these things so that by the time we are having a national strike, then we have a minimal service in place. They never do that. They don't take this thing seriously. They only start talking about minimal service when doctors are on strike or medical practitioners are on strike. But if you ask me if we'll be able to do this thing, then that is the only way we'll start saving lives as doctors are agitating for their rights.
I get minimal service. I'm also just trying to think, why do we need to strike and then use minimal service? What's the fix for that? And you've hinted towards it, but it requires all hands on deck.
It's reconciling so many truths, and it's a tough one. There's something I was going to ask, but let Eric come in.
I'm concerned, and I'm somehow conflicted. So yes, there is the welfare of a doctor as a worker. In terms of I want career progression, I want to be guaranteed that I get in here and there is clear path of my growth.
Yes.
And this is where the promotions come in. And then I also want to know that my pension is taken care of. If I want contract, then there's gratuity and such and so on and so forth. I mean, this is, at a personal level, this is clear. It is the cause for the current strike that I'm having an issue with. The current strike is because of a disagreement on medical cover.
Yes.
Because doctors who work in public facilities do not have faith in the public facilities that they work. And that's why they do not want to be given any cover that gives them access to the public facility they work.
Okay.
And I move beyond just the doctors into the entire mindset of public officers in Kenya.
Exactly.
That none of them would prefer to go to a public facility. I mean, we see teachers threatening to go on strike because their medical is being pushed to public facilities.
Yeah.
They want their own where they can access healthcare in private sector.
Yes.
Members of parliament have huge cover that gives them access to private sector. There's a privatization of healthcare in this country. It's gone on for long. It's now become normalized among the cadres of workers in the public service. That I know I'm in public service, but I offer service to other people, not for me.
Yeah.
And the people like me. People like me get our service elsewhere, which will lead to the kind of quality that we continue having, where you don't have consumables, you don't have equipment, you don't have. It doesn't matter whether you are given if you got your medical cover back to the private insurer that you are getting, you'd go back to work tomorrow, knowing that you have a problem with consumables, knowing that you may not have the gloves to go into theater with, you don't have the scrubs, you will not have access to lab that's working, all those things. But as long as you're getting your salary, your medical is with private, your gratuity is guaranteed. You will not go on strike, but you will not agitate for better, for this.
For better
And
public healthcare.
not just you as doctors, but everybody else.
Everybody else.
The CEO, the CS, the CECM, the governor, the deputy governor will not, because Sakaja is not looking to go to a Mbagathi or Mama Lucy.
Yeah.
He is looking to go elsewhere. How can we sort this out once and for all? And I'm asking this because many times I've had conversations with doctors' unions over this.
Yes.
And the justification for strike is I am pushing for the welfare of my patient. When I am seeking this, I am pushing for the welfare of my patient so my patient can get better.
Yes.
I'm sorry, but I don't see it. I haven't seen the needle move on this in terms of doctors even coming to say, so this is how we can ensure that the facility in which I work is better equipped to offer the service.
I'll give you a scenario, by the way. We've been doing it for years, by the way. Because you see, our core mandate as KMPDU, number one is to the doctor, so secure better working conditions for doctors. And of course, the other thing is to offer employment, halt brain drain, and even brain rot, because of the level of unemployment of doctors. But the third one is to fight for a space in healthcare where both the provider and the patient thrive. That we've been doing. There's a strike we went on in 2019 December. This strike was specific because we wanted better healthcare. This was for the patient. This was the first strike ever in the history of this country that was not even supported by the Kenyan himself, not even by the government. The government did not even call us for a meeting, and that was a national strike. The strike ended for 2 weeks. And we said, okay, because this is not for us. This is for the Kenyan. There's no priority. Nobody's even talking about it. Because we were talking about availability of drugs in hospitals, non-farms, and all those things. Specific. It was the worst strike ever. So that tells you the priority of Kenya as a country first, before you even go to the leaders. Because you can imagine, for something that affects you, because we expected this should be the most effective strike. We expected that patients who come to Mbagathi will come to the street with us. Patients who go to Homa Bay level 4 will come to the street with us. Nothing.
So you give up?
You don't give up. We continue. And we've been doing this. I think the next time we come to this show, probably maybe even the guys from the national level, they'll tell you and give you a briefing of our strategic plan and what we're doing. Because we didn't talk about the doctors alone. In that strategic plan, which is 2025 to 2024 years, 2029, we've talking, there's a space that for the patient, space for the Kenyan. Because to us, the only way this thing works is, number one, a doctor who is happy. But most importantly, a patient who is happy. A patient who comes to the hospital finds a doctor, finds the drugs, and can go home happy. That when you come with your kid, you know you'll come and find a neonatologist or a pediatrician. You'll be sorted out. When you're prescribed for a drug, you'll just walk across to the pharmacy and you'll get that drug. There's no need of me seeing a neonatologist, and then when I go to the pharmacy, the medications are not there. I'm told you have to go across and buy these medications at probably 10 times the price. So we talk, like if we talk about these things, and trust me when I tell you this, we will not give up. We have not given up on the doctors. This thing started in the 80s, Doctors Union. Started in the 80s when we had an outflux of doctors going to Uganda, South Africa, and that. But then there were few, like 80 doctors, I think, less than 200. That's when it started. But we've kept the fire burning. We've held on to the mantle. It's now 2026. KMPDU is doing better. KMPDU is strong. I will even dare say KMPDU is the strongest union in the country, in the continent. We are invited in so many international events. Why? Because they've seen the power, they've seen the fire in us as a union. So we are doing it and will not give up on that.
Let me ask, and this is just a general question. There won't be anything in the budget that says, NMS, doctors were under NMS for 2.5 years, your gratuity has been factored in. But I'm just trying to see if the money for these promotions, for a separate medical cover for doctors, a private medical cover for doctors, as well as this gratuity for these doctors, if those were anywhere in the budget cycle.
Budget, so what we were told, money for gratuity, and this is from my talk with the CS yesterday, money for gratuity will be factored in the next supplementary budget. But you see, that is something that we'll have called us on the 23rd.
By the county or national?
That is county. Yeah, call us on the 23rd December before patients die and all these things. Tell us that. Let us have a discussion around it. That did not happen. So we were told yesterday. So that is okay. We'll go to the meeting and hear. Money for promotions, we are told they requested the county for that budget. So it's for them to go convince the county, because money is there. It's only now that they need to prioritize. It's not like money is not there. There is money, but the county assembly needs to give a go-ahead for that money to be used for promotions.
So the money, had it been budgeted for, or is this just from the county's health budget?
The money had been budgeted for promotions.
Okay.
Yes. Okay. For gratuity, supplementary budget. We can take, I will not be sitting out at home waiting for money for gratuity for the next 6 months. If you tell me in the next 6 weeks, this money will be there, and you tell me on the 23rd before we went on strike, trust you me, we wouldn't have lost lives.
Medical cover, sorry?
Medical cover, now that is something we need to discuss. Again, we discussed it yesterday. I think it's something that can be done if these people are serious to sort it out, because the issue is just accessibility. That is one. The CS was telling me, because the other issue that has been a problem for us was that each month before the premiums are paid, there's always that gap that you don't access. And it can go up to 2 weeks. So you can imagine, you are paying SHA, you'll pay for the whole month, but you only get access for 2 weeks. They say they are sorting it out. They were working in tandem with the national government. At the county level, they were saying there's something that they're working out, and they promise that they have good news for us today. So we're waiting for that good news.
Okay.
Because so you sort out the issues of premiums, accessibility to any hospital, because if I'm living somewhere near Machakos, I don't need to rush my kid to Avenue or to Aga Khan. I want to have accessibility to a hospital that is near where I live.
I think we'll end it there. So today's the meeting. So hopefully from there, there'll be some development.
Before you end it, I wanted to give you a story.
Very quickly.
Very quickly. Maybe less than 1 minute. It's a story of a young girl, 16-year-old, came to Magadi Hospital like 3 weeks ago. I will name her Mary. She was coming to deliver. She was term. She was in labor. The good nurses assessed. I wanted to refer to Kenyatta. They couldn't. Now, unfortunately, I was trying to refer to some of these other faith-based organizations. The little lady delivered. But unfortunately, she got something we call a third-degree tear. Third-degree tear, just to put it in perspective, is unafungua mfereji or you have a water burst and maji is just inamwagika, literally. So these nurses struggle, calling everywhere, calling Kenyatta. Kenyatta have more than 100 third-degree tears now. They cannot take another one. They are full to the brim. They are overstretched.
Meanwhile, she's bleeding.
This lady bled the whole night. These people are struggling. I'm telling you this story because it's important for people to appreciate that it's not just Mary. It's not just that 16-year-old girl. We have John, we have Tom, we have Joseph, we have Sylvia. They're bleeding right now as county government is waiting for us to have a meeting.
And Mary would have loved to afford private health insurance.
But she can't.
Yes.
But she
And
can't. But that's why we should make our public health work.
Yeah.
And
But
force everybody who gets paid by us, our taxes, to first use our public facilities. Well, that's another conversation.
I agree with you.
Yeah, Dr. Maero Deogracious, KMPDU chair for Nairobi. Coming up, we have Your World, the energy drink trap. The cost of borrowed boosters is the conversation with Mwikali and Winnie, unless Philo tells me that this... Borrowed boosters.
What?
Yeah, your energy drink trap.
Okay. Okay.
That's on NTV. The poster is on your screens for those watching. Nation FM, Claudia Naisabwa and Brian Aseli will have the vibe shift from us. Jan Bogwa, Mariam Bishar, Eric Latif will be back here tomorrow morning, fixing the nation, one conversation at a time.